Hey everybody, Dr. Mark Bowers here. I'm going to try something new. This is a Q&A session, and this past week we went online and asked followers, people that visit our clinic, just people that subscribe to our social media channels to submit various questions related to child psychology, child development, parenting, basically anything that is going to make life easier for families. We want to hear about the concerns and questions that you might have. I understand, these days too, that waiting lists are incredibly lengthy, sometimes costs, insurance being able to pick up tabs. There's so many different factors and considerations. So the more that we can sort of get messaging out there and help individuals, because oftentimes families are having difficulty that doesn't necessarily require office visits, psychological intervention. They just need to sort of spot check some things and fine tune some things. I think this will be a good space for that. But also, if you are already in treatment and you're still getting stuck and there are things that you've tried before that haven't worked, we'd like to hear about that too. For future sessions, some of these will be just kind of how they are today as far as listing off questions and answering them. But keep an eye on our website, drmarkbowers.org, for announcements for future Q&As. Potentially, ideally, we could do these weekly and even start doing some live sessions as well, where you're welcome to log in at the time of the Q&A and ask your own questions that way. Also understand people have busy schedules and other commitments, so these will all be recorded and posted on drmarkbowers.org as well for your convenience to be able to review these answers whenever you'd like. So welcome, and I'm Dr. Mark Bowers. Without any further ado, I've got my handy list of questions here in front of me, so I'm just going to kind of go through and see how far we get. We've got about 30 minutes today to get through as many questions as we can. And obviously this isn't a back and forth, so I will do my best to answer the question as it's written. And I apologize in advance if maybe you were intending it to be kind of looked at a different way. You can always interact with us on social media, send us a note, send us an email, whatever works if you need additional support. All right, so the first one is, what do you advise parents of autistic kids to do when the kid is stimming? For example, jumping or hand flapping, as long as it's not harming them or others, allow it. We just sit there or we jump with them? So that's the question. It's a great question, and I get this a lot. And oftentimes too, before a child is even diagnosed, there will be a lot of stimming, we call it stereotypies or stereotypic movements, and that can include rocking, spinning, hand flapping. Some kids get on the side of their head and kind of will roll a truck in front of their eyes. Some kids will tap or do other things kind of out of the periphery of their eyes. Some kids get into even habits like skin picking and things. Whether or not we call all of that stimming, usually it's the more rocking, gross motor, flapping, spinning type movements that we refer to as stimming. And yes, I mean, stimming is a way of expressing, so we don't want to interfere and interrupt. However, we also don't want to just let the child go down that rabbit hole, as we call it, where we sort of lose them, right? So when a child is engaged in a stimming behavior, and a lot of kids will get home from an event, an activity, even school, and they will pace in the house. So they have a certain pattern or a pathway they'll use, and they'll maybe tap along to it while they're pacing, listen to music, stomp around, march in a certain way. Those are all stress relievers, stress busters, and so obviously we wouldn't want to interrupt and prohibit that. But at the same time, we also, I've worked with families before where they had carpeting and there was so much pacing going on, like the carpet gets worn down, or it's loud stomping from the second floor that causes a disturbance to people trying to work on the first floor. So there's obviously some considerations, and sometimes instead of saying you can't do that, families will say things like, you can do that, but we need you to go do it in the basement, or we need you to go do it in your room, or someplace where it's not going to maybe affect or adversely get in the way of what other people are trying to accomplish in the house. And then sometimes even setting a time limit for it. But there's other things you can do when a child gets really immersed in something, whether it's a stimming behavior or a dominating interest. And we will find that sometimes we lose the child, right? When they're flapping and they're spinning, they may not want us interacting or engaging them or interrupting them. And so if you need to sort of pull them out of it, though, some helpful techniques are to just sit with them and kind of observe what they're doing, and don't judge it, don't comment on it, just be with the child. Another thing you can do is join the child, as this question kind of alluded to. You can join the child in what they're doing. Now, you may not feel comfortable flapping or spinning, but you might stay with the child and maybe walk a little bit back and forth. And you have to kind of read their cues. We don't want them to misinterpret what we're doing as that we're mocking them or imitating them. We're actually just trying to engage with them. We're trying to join them. And another technique is to kind of take what they're doing and make it even more exciting or do something really exciting or interesting to the child within their line of sight. And this could be a young adult too. It doesn't have to be a child, or it could be an adult even. So all of those are helpful. But the bottom line is, not to interrupt. There's a pretty good book out there called The Reason I Jump. I think it's by Naoki. I forget his last name. So, but you can definitely look that book up, The Reason I Jump, and that has some insights into it too. But a lot of times it's just stress relief. It's not harming anyone or anything. It might interrupt or kind of be noisy or disruptive in some ways, but it's not harmful in any way. So hopefully that's helpful. Another question is tips for parents whose high academically functioning AuDHD kid is going through school refusal and can't articulate where their anxiety is coming from. And as an add-on, where would we turn for help? And this one is complex. I mean, anytime we get into school refusal, we know there's anxiety, so that's the first part. Where their anxiety is coming from, it can be a lot of different things that can be difficult for the child to necessarily articulate, or the student to articulate, regardless of how old they are. And that's usually where we need help. We need guidance, we need data from other sources. And given that the child is going to school while they're at school is really where we want somebody that can sit down with them and really, or even kind of track their movements through the day to try to determine what sort of patterns are emerging. Now you can ask the school to do something called functional behavior analysis, FBA, which basically goes through and tries to identify what we call the ABC of a behavior. The antecedent is what happens before a behavior occurs, the behavior itself, which in this case would be avoidance, refusal, and then what is the consequence for that. And so usually the consequence for avoidance and refusal is that you don't have to go to school, which means you avoid the antecedent. And that's really where the intervention needs to happen, is the A level. So the antecedent is, why is this? That's what the question's all about, right? Why is this child refusing to go to school? And if it's an AuDHD kid, we have to rule out that there's anything academically going on. Is learning a challenge? Is processing speed a challenge? We also need to rule out that there's anything social going on. This child doesn't feel that they're part of the group. They feel left out. They feel embarrassed. They feel isolated. Maybe they have social anxiety and they're uncomfortable and embarrassed. Maybe tests cause them to get really stressed out. Maybe they find every class in that school to be incredibly boring and not worth their time. Maybe there's sensory overload. So those are all factors that even before the child can articulate it, we should be seeing some evidence of that. That should start showing up in different behavioral manifestations, which we can identify ideally when the child is at school. But whenever there's school refusal, we have to coordinate our efforts with the school, get data from them, share data from home, try to figure out what those patterns are. One key test that I like to look at is how dramatically different is the child's behavior on weekends and holidays when they know they don't have to go to school the next day. And a lot of it comes back to anxiety. And so that's why they may not be able to articulate it. It might just be, the limbic system of their brain, or they go into fight or flight mode, right? The sympathetic nervous system just goes into overreaction, and it's false alarming all day. And the kid goes, I don't know. You drop me off at school, or the bus drops me off, and as soon as I start walking toward that door, my system just starts going. And what they're feeling is like, I got to get out of here. Danger, there's something bad, because walking toward a building and having that feeling, that's obviously, when little kids walk toward their pediatrician's office, if they've gotten, shots before, it's a conditioned response over time. They begin to associate that environment with discomfort and pain potentially. And so that's really all we need to know. And so then we have to then back up and determine how can we help this individual assimilate, integrate, engage, initiate with what's going on. Is this a child who needs more control in their life? They have to follow their own plans. And what's school? School is someone else's lesson plan the entire day, essentially. If you want to get through it, you got to pay your dues and check off all the boxes to get through someone else's lesson plan that is not your idea. And it could be something too, like handwriting is painful. So there's so many different options, and that's where we really need a collaborative approach. Psychologists can gather up a lot of that data for you in a clinic, and then they can help you to coordinate care with the school, or you can start with the school first and see what you can determine that way. And if you feel like you need additional supports, then you can look in your community or elsewhere to try to find a mental health professional who can support you with this. All right, why do screens have to be constant and so loud? Well, they don't have to be, but I understand if this is a situation going on in your house, we probably have to come up with some compromise, because what oftentimes will happen is that this is a sensory-seeking child. This is a child who probably likes things hot and spicy and a lot of pressure and a lot of proprioceptive input, what we call sensory seekers. And so now these are the kids who will cover their ears if something in the environment that was unexpected is too loud, but when it comes to their control over the volume knob, they take it, as Spinal Tap would say, they take it to 11. And so, that can sometimes be something that we need it to be so obvious, so black and white, so loud that it allows us to really feel it, to experience it. And some kids like to hold the tablet while it maybe vibrates a little bit from the loudness, or connect it to a Bluetooth speaker that has a little bit more of a bass register on it, so there's a lot more of that kind of sensory input feeling from it. But really, if it's bothering you or it's interrupting the environment, then we have to come up with a compromise, and we have to be careful. And good news is a lot of these devices now, if you swipe down from the corner, it has a little ear with a little volume, that's at least on the iPhones, that you can set your decibel level so that you're not going to harm hearing. And then what we would try to do is compromise with the individual and try to get them some good headphones that they can tolerate, that feel good on their ears or on their head, that they can feel comfortable with, and then they can crank it, although we cap off, so we don't want to encourage hearing loss here, so we cap off how loud they can go. But with the headphones against their ear, it gives the impression that it's just as loud as when they're holding the tablet. And also, sometimes people will crank up the volume to try to drown out noise around them in the environment. And so having it really loud on, even if it's just in the background, it's kind of like, to that student, it would be kind of like a white noise machine. Although to us, we start tuning into what they're talking about and the way they're saying it, and if they're laughing really loudly, that causes the speaker to rattle usually if it's cranked up on the video. And so what it starts to annoy and bother us because we're tuning in. The child or the student may not be tuning in. They might just be using it as a sound bath, a sound wash. And so we just have to kind of negotiate that hey, like if you want to listen at that volume without headphones, fine, but you got to be in your room. And then obviously we may have to kind of think about setting some limits around the screens and how often they can have access to it. So think about headphones, think about other ways to kind of negotiate some of this, and understand that a lot of this might have more to do with just comfort and sensory registry. All right, next is what makes a kid want to destroy stuff that they really like. Not even in a fit of rage or anything, just literally calmly and like normal play, but they're destroying stuff every day. Is it an issue of attention seeking, or is it a control thing? I'd have to actually see a video clip if you're interested. We do offer that, video clip reviews, if there's behaviors going on, and that might even apply to a stimming behavior if you wanted somebody like myself to take a look at it for you and give you some guidance and advice on how to respond to it, how to react to it, what to do about it. But in this case, I don't know for sure that it's even an issue of attention seeking or control. My first reaction when I saw this question was that it might be more proprioception. And for those of you who aren't aware, proprioception is a sensory term. It's an occupational therapy term about how much force or pressure is required on an object to manipulate it or make it move. And I can tell in my office immediately if I have a child in here who has proprioceptive challenges, because they're not angry, they're not hyperactive, they're not impulsive, they're not out of control. They are just flat, having a good time, playing with my toys that are in the office, and I'll start to hear, as I'm gathering history while the child's playing, I'll start to hear cracking noises. And what that means is that the child is, action figures and other toys have things that, open and close and swing and swivel and move, but they can only go in such a range of motion. But kids with proprioceptive input challenges will not be able to sense those cues. And so they will push an action figure's leg up so high that you start hearing it, that little cracking is what tells most of us, ooh, you gotta lay off, right? It's starting to splinter a little bit. But the child's not gonna read that cue. And so as a result, you'll get lots of broken toys. This is a kid who might also, a test for proprioception that I like is when your child opens and closes doors, what do you notice? And if you've got a real loud slammer, again, they're not mad, they're not angry, they're not slamming the door out of rage or frustration. They don't understand how much force needs to be applied to that door based on the weight of the door in order to get it to close gently. They just give it an old heave-ho. And so you do hear loud door slamming. We even have kids, if you have, kind of less quality glass in your windows, and some kid might open or close a window too hard, and we've had instances where it can be dangerous, right, where things shatter. But what you usually see are the door slams. You'll see like pencils, when those start getting going, when the lead's getting broken really quickly, they're putting too much pressure down when they're writing. Or anytime they're manipulating an object like a toy that has points of articulation, they may end up cracking it, snapping it, or having it break. So if it's really as you describe, I would guess, that would be my hypothesis, that it's not control, it's not attention. It's just that they're not reading that proprioceptive input. And if you want to intervene on that, we may have to either get toys that don't manipulate as much, or even do an occupational therapy consult to see if there's some exercises or some techniques that we can use to start to increase that proprioceptive awareness. All right. Next one, what is the consensus on screen time for our kids? If I take it away, he basically tortures the entire family till he gets it back. He doesn't care about anything else. Yeah, I mean, that's This is a big one, right? I mean, this is what most families struggle with. And, if you look at the mental health data when the iPhone came out, I think it was 2005, but you start to see, if you look at the trend lines, the rates of depression and anxiety once kids really started to get access. Before COVID, right, before 2020, we were already, pre-pandemic, we were already at crisis levels of mental health crisis and levels of depression and anxiety in children with these devices. I am confident that I don't know that I'd be totally out of work, but I would be very kind of twiddling my thumbs if we did not have these devices. I think a lot of mental health issues these days are because of these devices, but parents are trapped, right? Because what do most parents tell me? Oh, well, but every other kid's got one, and if I don't let my kid have one, then they lose connection with all the other kids. Well, a lot of times the connection that's happening are with kids they're never going to see in real life, and sometimes that's potentially dangerous. And sometimes the connection they're having with those kids, they're not telling you about it, but those kids are being rude, those kids are being mean, those kids are bullying or leaving your child out if they're interactive. But the kids who don't have any of that and they're just watching videos, again, depending on your filters, your sensors, your safeguards, and your protections, which a lot of kids can work around these days. Who knows what kind of content they're watching when you're not available to monitor that. And kids get a dopamine hit that is like no other from being on a screen. And if you've got a neurodivergent child, like a child with autism or ADHD, when you give them a screen, there's nothing else that feels better to their brain. Nothing else competes with it. Unless, of course, you gave them like cocaine or something, which of course you would never do. And I'm not comparing your phone to cocaine, but the way that the brain reacts, if you look at it under fMRIs and PET scans, it looks very, very similar. The way that the brain lights up when you're given a tablet and then when you're given a dosage of cocaine. So, parents would never give that to their child, but we're giving them these devices. I get it. Our society's doing this. We have to keep up. And also, we do have to prepare kids. I mean, they're not going to grow up into a world that doesn't have screens, so they are going to need to know how to coexist with them. But if you've got this kind of reaction, then you're getting a lot of an addiction kind of response and a kid who's jonesing for dopamine. These are the kids who will complain of boredom anytime there's not a screen on. These are the kids who will hold you hostage when you're out in public about when you're going to get home. These are the kids who will always beg you for more and will flip out if you take it away. And the best rule of thumb that I can give any family when it comes to this screen stuff is take whatever screen allowance you're going to give. Let's say it's an hour a day. That's probably pretty low, but let's just assume it's an hour a day. Put it on an island and let the child have that no matter how good or how bad their day is. Because once we start giving more screen time for good behavior and taking away screen time for bad behavior, we are conditioning the child about just how important and powerful this device is in their life. And so what you'll do if your child starts to learn over time, now you're going to have to absorb the initial impact because your child is going to try every opportunity to try to get you to reward them with more screen time in the beginning. But what you have to do is sit them down and say, look, we are giving you an hour no matter how awful your day is at school, no matter how rude you are at dinner time, you're going to get your hour. But you are not going to ever get more for doing good things, and you're never going to get it taken away for doing bad things. We have to find other ways to kind of handle quote unquote bad behavior. And then that way the child will learn over time, I can only get it this much, it's no use. And then we'll start to see that kind of badgering and pestering go down. But we have to have limits on this too. And so if this is a child who is attending school, one of the other things that helps a lot of families is no screens or no tablets, handheld like devices if they're younger kids that don't have phones yet. No tablets Monday through Thursday, no video games. You can watch some TV shows or a movie if there's time. But other than that, if you're going to game or do other interactive stuff or browse through YouTube stuff, let's do that Friday, Saturday, and early into Sunday. But then let's get back on track to go back to school. So questions like this are great. I would encourage you to think about my island approach because that does really help right out of the gate. But there's probably more layers to this that need to be explored. And a lot of times these kids just don't know how to self-soothe. They don't know how to entertain themselves because they've grown up with these things. And what these things do is they rob children of their imagination. They do all the work for the child. And so they don't get that ability to sort of create something, build something, innovate, come up with things on their own as much when they're just sort of sitting here and on the tablet the entire time. So hopefully that helps, but I'm guessing that there's a lot more depth to that question, outside of the scope of this Q&A. Okay, what is the difference between going to a pediatrician for ADHD testing and going to the psychologist for ADHD testing? That's a great question. All these are great questions. There's a lot of differences, and nowadays too, what I'm at least seeing here in the great state of Michigan is that pediatricians are, they're referring a lot more out to mental health in order to do these assessments. They're not doing them as much in clinic. I think the old rule of thumb, if we go back to the 80s and 90s, was you'd go into the office, you say, my kid's got a lot of energy, they'd be running around the exam room, the doctor would take a look and go, I agree, we usually use a little medicine for this, what do you think? The parent would go, okay, it's worth a shot, put the child on medicine. Sometimes it would work, sometimes it wouldn't. And unfortunately, that's where I think ADHD and medications started to get a bad rap and a bad reputation, because I can't tell you how many times I hear from parents, oh, I hear these medications cause kids to turn into zombies and they cause all these problems. Well, any medicine will do that if you're not using it for the right thing or you're not using it the correct way. It's not because these are kids necessarily, and stimulant medications have been around so many decades that researchers have run out of things to study with stimulant medications. They don't even look at medications like Ritalin anymore in the research because it's all been done. And so we know these are safe, we know these are effective, but the pediatrician, depending on where you live, will sometimes, at least at this stage in 2025, they will do more of a screening. They might ask you to fill out a checklist, they might even give you one to ask the teacher to fill out, and they'll take a look at that. But oftentimes that won't be enough for them. Back in the day, that might have been. So nowadays, what they'll do is they'll send you to somebody like myself, a psychologist, who can do a formal assessment. And the difference there is that the psychologist is actually going to look inside the child's brain, so to speak. We're going to have them do various activities that require executive function and attention and focus and concentration and impulse control in clinic, where it's highly controlled. The environment and the stage is set for the child to be successful. And that's where you can see true pathology play out, when everything is sort of quiet and calm and ready, and then the only thing that's disrupting that is the child entering the room with their behavior. Then we start gathering data. And so a psychologist who does ADHD testing is going to use some checklists, but they're also going to use more direct measures, which is really my preference, because if you're only using a teacher checklist or a parent checklist, then we have bias. This might be a teacher who says the child is way worse off than they really are because they're burned out from this child for the duration of the year that they've been in class together, or they might undercut it because they get pressure from their administration to not have too many people on plans, or maybe the child is masking, or there's so many other disruptive children in that class that your child doesn't get noticed as much. So I really try to be careful with a questionnaire only approach, just because false positives, false negatives can occur, and we want to make sure we get an accurate assessment. But the child can't escape if they're looked at by a psychologist directly one-on-one. And these are just brain games. These aren't things that are painful or uncomfortable for the child. This is like working with blocks and puzzles and doing different things to try to test their reaction time, their impulse control, their focus, their concentration, their attention. And seeing how that all plays out allows the psychologist to then write up a report that doesn't just say, oh, this child has an attention deficit disorder. It also allows, the psychologist is also going to say, now here's what we can do about it. And a pediatrician is sometimes limited. They might be able to prescribe medication, of course. They might also be able to write a quick script that says, please consider starting an IEP or a 504, but they're not always usually going to be able to weigh in on the child's specific profile. The psychologist will be able to map that out for you, and it'll be a lot more in-depth and a lot more thorough. All right. Finally, because we only have a couple minutes left, I'll just throw this one in there. How often should an autism diagnosis be reevaluated? That's really kind of up to the family. I tend to only reevaluate in a couple of situations. One is when the insurance changes, or the child reaches a certain amount of years of intervention through the insurance, and the insurance wants kind of an updated look, and they want to make sure that what they're providing is still important, indicated, necessary. Another time is when a family, I just did one of these recently where the child was evaluated very young before they were speaking. They were nonverbal at the time, and some of you may be familiar that we're asked to give these levels now when you give an autism diagnosis. There's levels 1, 2, and 3. 1 is considered the mildest, 3 is considered the most severe. And I've had children that show up as a level 2 or a 3, which is sometimes, that's an artifact. That rating gets artificially inflated early on when the child has more limitations. And as the child makes progress and improves and grows through therapy and development, then the family will sometimes come back and say, we want to get another look and see, like, it's maybe time to start with some higher level goals. Before we were doing eye contact and speech and sensory, and now we need some more social skills, which are very high level goals. So there can be a lot of different reasons why you would evaluate and reevaluate. It's only important if there's been some change and you are interested in getting an update on how those changes can be further supported. All right, well, that concludes our first Q&A. I hope it's been helpful. These were some great questions, and unfortunately I didn't get to all of them. I've got quite a list of many, many more that were submitted, so keep those coming. I appreciate those of you who've sent these in, and we'll do this again next time. Take care.